Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter S. Today I'm going to talk about the synovitis. It's a joint disease actually. Usually it's associated with the arthritis. It's part of arthritis. However, it's not in all the joints because now there are different kinds of joints in the body. Some of them belong to the synovial joint, like shoulder or knee or something. For example, I give you. Let me just bring up the emergency situation associated with this synovitis. Actually, it's similar as arthritis. If the emergency situation, acute infection, for example, swelling, feel warm, and redness, could be a viral infection, part of the viral infection, could be systemic sepsis, bacterial infection, or could be localized bacterial infection. And injury, it's open or closed injury, swelling. So these are the emergency situation, or the injury associated with feeling numbness and tingling in the extremities. So if that's the case, still need to see the emergency room. Usually that is not quite associated with this arthritis or synovitis. But still, this is the emergency situation associated with the extremities. Any synovitis you manage at home? Probably not. Even though, like I said, viral-caused arthritis, you still need to be diagnosed. To be excluded from other serious problems, to make sure it is viral-caused arthritis, not bacteria-caused arthritis, or if just it is only the localized viral-caused arthritis or synovitis, but not the part of the systemic infection. So this is still need to see the physician to diagnose and to, even though just the supportive care, anti-inflammatory, like over-counter medications, but still need to be diagnosed first under the physicians or professionals. So this is about the emergency situation. Let me just bring up the fundamental basic about the joint and some terminologies you probably heard it: tendons, ligament. What a difference! They're all the collagens, connective tissues and collagens, the thick fibrous structure. The ligament are the collagens between the bones. So that's just the fundamental concept. And the tendons referring to the muscle to the bones, the attach muscle to the bones through the tendons, and the ligaments are attach the bones through the ligaments. So this is, and also the different type of joints. Some of them just like the pivot, just grounding, or like a hinge, or some of them are fixed without any mobility. For example, the joint is referring to the concept connect the bones. The skull, for example, those are the fused joints. There's almost no movement at all, or just limited movement. So that's the and there's some other different type of joints. One of the most complicated joints are called the synovial joints, which refer, like for example, the shoulder or the knee containing the synovial sac, or there's a sac structure containing the synovial fluid. Those fluid usually is kind of greenish, clear, full of nutrients, hyaluronic acid, for example, to lubricate, to buffering the mechanical strands between the bones, and also to provide nutrients. So this is the synovial fluid. Usually it's clear, a little bit greenish, or almost white greenish, that kind of. But it's very transparent. So these are the normal synovial fluid, and those sac are really surrounding the joint to protect, and also to lubricate, to protect, to provide nutrients. So this is about the fundamental structure. So the inflammation of this synovial sac among the joint is called synovitis. It's part of the arthritis. Sometimes it's just around the joint, the inflammation or the infection just depends. They could be just for those joints without the synovial sac, then it's just the joint infection or joint inflammation. For shoulders, like the synovial joint, for example, maybe just the sac itself getting inflamed. That's called the synovitis. So how to tell the synovitis, either caused by viral infection, bacterial infection, or chronic inflammation, or the autoimmune inflammation, or just the degenerative change caused the fibrosis. These are usually by the X-ray is one of the method, or the fluid. Usually for those acute, particularly the inflammation of acute, the synovial fluid will increase. You feel when you, for example, the kneecap, when you press it, it can be floating. So that means the synovial fluid is increased because of the serous or either other type of fluid to surround the sac. So usually that's the diagnosis. We just aspirate of those fluid to examine under the microscope, see whether there's like a gout, for example. Synovial fluid also can be increased effusions around the joint in the synovial sac. So then aspirate of some fluid, look at under microscope, see whether there's a bifringed negative needle-shaped crystals. So this really kind of helps diagnose gout. Or look at the cells, whether there is some a leukocyte or lymphocyte. The leukocyte increase, which is white blood cells and neutrophils, for example, that means acute bacterial infection. Or lymphocytes could be viral infection, or could be this is just the give you idea, give a lab person or physician idea what might contribute to this effusion around the synovial fluid or a synovial joint. And so this is about the diagnosis. Usually, if the effusion usually caused by the inflammation or infection, in terms of degenerative change, probably it's fibrosis rather than effusion. But anyway, so this is after the diagnosis, your physician will treat accordingly to give you, if the bacterial infection increase white blood cells, neutrophils, then to diagnose, to culture, see whether to identify the causative pathogens, and then to give the prescribed antibiotics accordingly. If this is viral, then probably no neutrophils, only lymphocytes, and the other components like protein, glucose, and other cells. So if that's the case, probably supportive care. If there's inflammation, then test the other factors, like rheumatoid arthritis can also cause this effusion of the fluid. Synovial fluid can also effuse, so draw the fluid and to test. Anyway, and this is about the synovitis. I think it's the terminology is not quite commonly used. Usually just used as arthritis, unless you specified synovitis, which means the arthritis occur to those synovial joints and also the synovial sac under inflammation or infection. So just a little concept clearance, I think, but usually referring to the other part of the arthritis. So I'm going to stop here and hope it helps. And probably if there's some information missed, I'm going to write an addendum note attached with this video. Thank you for watching. I will see you next time.